My name is Paul Gong. I am a pediatric headache specialist working at Norton Headache Center. I love seeing kids, especially those with headache disorders, because I feel like I can provide some meaningful help in their quality of life by teaching them about their disorders and finding ways to treat their pain. I see kids really of any age, but mostly the populations I'll be seeing are adolescents and then even some young adults. I'll also be seeing some adults up into the 30s and 40s, but like I said, my specialty is in pediatrics, so majority of people who come to see me will likely be in their adolescent period. A lot of people don't know, but migraine is the leading cause of global disability. A lot of people feel that migraine is just a really bad headache, but migraine is actually a neurologic disorder that has a lot of symptoms that include headache. But because of that, it causes a lot of disability. So whenever I think about treating someone who has headaches, I always think about pain and disability. And the pain component is a big part of it, but I would say just as important as the disability part. And so the main things I try to do when I treat someone who has headaches, whether they're a young toddler or even someone who's an adult, is first, educate them about what their disorder is, what it means for them, and validate all the struggles that they've been having because of that disorder. Try not to I definitely don't want to dismiss, and definitely want to make sure they're not feeling dismissed for any of the symptoms that they have that have caused potentially lifelong issues. So that's always my first step, is seeing the patient and making sure that they know that everything they've gone through is real, and I see them, and it's something that has been really hard. From there, then I talk about ways we can help. So of course, there's always medicine. As a doctor, we always have prescriptions we can write, medicines we can offer to help. But the thing I love about treating headaches in patients who have them is that there are a lot of ways to treat. And so if people want to take a medicine, I can offer that, but there's other things I can offer, like procedures. I can offer education and advice on lifestyle changes that they can make by themselves that have been proven through lots of studies and lots of experience to help them as well. We also know that the psychological side of headache disorders is important. So we know that different types of therapy, specifically cognitive behavioral therapy, is something that can help with headache disorders. So that's another thing we can offer. So I love treating headache disorders because of that reason, that I'm not just someone who sees a patient and can only offer one pill after the other. I can really offer them a whole human, whole person approach and tailor their treatment to what they feel like is best for their lives. I am married and I have 2 little boys, so I love to spend time with my family. We love watching shows together on the TV. We love taking adventures to parks, and we love playing sports together. So that's one thing I love to do for fun. I'm also a huge fan of technology in general, but most specifically computers. I like to build my own computers. I like to play video games on my computers. And then I love basketball. I love just shooting the basketball in my backyard on the hoop. I also love playing pickup games with friends. I'm a huge fan of the NBA. I'm a big Pacers fan. So I love watching them play on the TV when the season's over.